So workplace wellness has been a priority this pandemic in any workplace that promotes health activities or organizational policy designed to support healthy behavior in the workplace. And to improve health outcomes, learn the best practices from our next speaker, Dr. Gia Season. So allow me to introduce you our speaker. So Doc Gia Season is a medical doctor, a breast cancer survivor, a strong advocate for mental health in the workplace, former consultant to the World Health Organization and International Labor Organization for the global practice of occupational health. Served also as the first Philippine leader of Livestrong Foundation and host of the G Talks CNN Philippines. Ladies and gentlemen, Dr. Gia Sison.
Make more time.
Hi, good morning. This morning's topic will be about revamping the corporate workplace wellness, promoting mental health in the workplace. I'm Doc Gia Season, and I hope somehow this session you would learn from it. So, workplace wellness means that we allow our people to flourish. Flourish may seems to be a very flowery word, but that's exactly the core of building mental health workplace policies. And when we say well being, we go back to the definition of what mental health is, which is a state of wellness where one realizes his or her own potential, one is able to cope with the stresses in life, and one is able to work productively. And in the PERMA theory of well being, PERMA stands for positive emotions, but I'm not talking about toxic positivity here, where we invalidate how others feel. We just want to work from an angle of being able to identify the strengths of everyone to be able to work productively. Then we have the engagement part, where individuals are more focused in what they do. We have positive relationships, of course, sans the negative or the conflicts that come along with it. But we use this as to leverage to make the relationships better. And we have the M, that's the meaning. Meaning is something that evolves. And in the workplace, this is very highly likely that can happen depending on the environment the employee is exposed to. And lastly, accomplishment. In the biopsychosocial model of health, we have three components. We have the biological component, the psychological component, and the social component. When the pandemic hit us, it hit all of them. And so we find ourselves in something that is new, like this virtual meeting, but it's also something that we have to start living with since this will be our lives for quite some time. Now, in the slide, these are actually six amongst a lot of mental health concerns in the time of COVID. There will always be that factor of uncertainty since we don't know what's going to happen. And let's face it, quarantines are and its effects long term in terms of loneliness, altered grieving process, and more or less, even if the economy has opened, we still encounter barriers in access of service, specifically mental health. And for those who are work from home, the lines have been blurred between doing work, household work, and professional work somehow, and amplification of social divides. Meaning to say, social, economic, we feel it more, most especially during these times. And based on the Philippine Business Coalition for Women Empowerment, they did a study on the key effects in terms of the pandemic on the impact to employment. Now, I'll just summarize what the slides, what the graphs are to your left, to your right. Sorry, the summary is to your left. It's more of 60% of those affected began working from home. 37% of employees could report that COVID-19 had no impact on their job. So it's more of those who are impacted and jobs suspended, hours and pay were reduced and forced to take unpaid leaves. And when you look at the spectrum of the same study, 48% of women and 39% of men reported a negative impact on their mental well-being because of COVID-19. And when you look at what stresses them out, of course, financial still tops the list, and then physical health, mental health, work performance, family pressure, and time management. So this slide is a picture of, and is trying to say that oftentimes mental health problems are complex and may be a combination of stressors both from the workplace and the home. So we never really can totally separate them. One can really be actually affected by the other. But I think what we can do is to buffer too much of its impact for better mental health and well being outcomes. And in terms of mental health problems, it has its effect both to the employers and to the employees. They both have decreased quality of life, economic effect, yes, because of increased absenteeism, and of course, stigma and discrimination, which we are all working to totally eliminate based on the mental health law. And when you look at the WHO service delivery pyramid, on the lower part of the pyramid is really about self care. So we cannot really put out self care out of the picture. And then it kind of goes up where the informal or the community starts to get him or themselves involved. And then primary care, mental health services, and then up. So as long as possible, we want to keep them on the first two where they take care of themselves. But at the same time, when it comes to uh, issues or challenges, they have a community of care that they can run to. And so let's talk about redefining employee engagement. In employee engagement, there are four pillars. We have the open communication pillar, where you start to empathize with your employees. We have the proactive strengthening of supports because um, employees need immediate access to support, especially when it comes to mental health. And we have to start to humanize workplaces. It's more of people are not robots or machines. These are individuals who are actually in need of help and support. And again, linking that to what I said earlier, we have to start destigmatizing seeking help. And this slide shows the six domains of mental health interventions. And the six domains involve job design, organization level, on the team level, and on an individual level. And let's talk about designing and managing work to minimize harm. This is where flexible accommodation comes in. So, especially now when the pandemic changed the way we work, we have to be more of a company that embraces this change and implements flexible accommodation. We have to involve our employees more in dialogue and ensure that whenever they work from site, they're safe. And changing the organization of work, I'd like to zero in on the clarifying job roles. This is very important because the employee should know where he or she stands and what she has to do. So review the work environment as well and clarify organizational structures and how they should practice this, most especially when everything has changed the way we work. And it's about time that we also build on workplaces that are psychologically safe. And what is a psychologically safe space? It's defined as a shared belief that the team is safe for interpersonal risk taking. So when you look at a drawing to your right, it's more of a question of will others give you the benefit of the doubt when you take a risk instead of the opposite. And on this slide, psychological safety means nothing you say or do will be used against you as long as you mean well. And it means that your teammates will assume you mean well until proven otherwise. Compared to an environment that is cynical and an environment that dwells on the benefit of the doubt, an environment that dwells on psychological safety is more of a charitable environment where I'm going to assume the best until proven otherwise. So it's a nice environment to be with where solid trust is there. And we need to also promote protective factors at a team and organization level to maximize resilience. I know resilience seems to be a term that we always use, but it's something that we need and it's something that we all have. And thus, this is where building a psychologically or psychosocial safety climate is very important, and trainings are important, and manage change directly. Enhance personal resilience, meaning to say it's not all about the organization too, because a team is made up of team members. And we have to ensure that each individual is more or less equipped in terms of managing stress. And this can be done through coaching and mentoring, frequent dialogues or with your direct reports or your IS, and of course, worksite physical activity programs. And let's promote also and facilitate early help seeking. In the advocacy of mental health, we would like to promote a proactive approach when it comes to mental health. Let's not wait for breakdowns to happen, etc. And this is where EAP comes in, employee assistance programs, and well-being checks as well in the workplace, and support workers' recovery from mental illness. Because let's face it, we have coworkers who have suffered from depression or other mental health illness, and this is where return to work programs are important, and this is where we express our support, and best time to make them know that they are not discriminated and things can go well. Now, early referral and support to employees at risk is very important as well. And this, how do we do this? Establish support groups if the population is at risk. Provide counseling. It's more of really opening avenues where the employees can run to whenever they feel that something is wrong about their mental health, and provide reasonable accommodation as well. And of course, provide treatment. You may want to have in-house professionals or teleconsults where they have immediate access to psychologists, guidance counselors, and even psychiatrists. And again, provision of health insurance, which includes mental health services. And this, just like this, we are doing increasing awareness of mental illness and reducing stigma. We have to do this on a continuous basis. It pays to be reminded that we are still in the process of stigma reduction, and we have to place initiatives that address that. So this can be done by capacity building workshops, and of course, making available curated, credible library resources when it comes to mental health. So that ends my slide for this morning. Thank you so much. And again, thank you for inviting me to the Philippine HR Assembly, and I hope I see you soon.
Yeah. Thank you very much, Dr. Gia Season, for a very informative session and for gracing our event. So, by creating the time and focus to improve the overall health and wellness of employees, managers can present many health and cost benefits to all members of the organization. So, kung meron kayong questions, feel free to message us sa CPHR Philippines inbox, and we'll forward it to Dr. Gia Season. All right. So,